Movement. It's something many of us take for granted. From the simple act of lifting a coffee cup to the complex coordination required for walking. But what happens when that control system goes awry? Movement disorders disrupt the speed, fluency, quality and ease of your body's actions. Sometimes it's too much movement, like the jerks of chorea, or too little movement, as in Parkinson's disease. Understanding these conditions is the first step toward managing them. Imagine your brain as a conductor of an intricate orchestra. It sends precise signals to muscles, telling them when and how to play their part. When signals are scrambled or delayed, movement falters. Knowing the cause brings clarity and guides effective care. Our journey begins with the blueprint of life, our genes. Many movement disorders are hereditary, passed through families. A mutation is like a typo in the instruction manual. In Huntington's disease, a single faulty gene causes progressive breakdown of nerve cells, leading to uncontrolled dance-like movements called chorea. Its inheritance pattern can often be traced through a family tree. Other causes reflect predisposition. Genes like LRRK2 and Parkin can raise Parkinson's risk, like a car with a vulnerable brake system that fails under stress. Environmental triggers can interact with genetic risk. Rare genetic conditions matter too. For example, Wilson's disease, where copper builds up to toxic levels, damaging the liver and brain, especially the basal ganglia. It can mimic Parkinson's with tremors, stiffness, and coordination issues. Dystonias, often genetic, cause sustained or repetitive contractions, twisting movements, and abnormal postures. A DIT1 mutation can drive early-onset dystonia. Understanding these links aids diagnosis and empowers genetic counseling. Beyond DNA, our environment can trigger movement disorders. Exposure to environmental toxins is a major cause. Chronic manganese exposure from welding or steelwork can cause manganism, closely mimicking Parkinson's with tremor, stiffness, and gait issues. It accumulates in the basal ganglia, disrupting function. Long-term pesticide and herbicide exposure, including agents like paraquat and rotenone, is linked to higher Parkinson's risk. They damage dopamine-producing neurons in lab studies. Carbon monoxide poisoning can cause delayed Parkinsonism, dystonia, or chorea. CO starves the brain of oxygen. Basal ganglia are vulnerable. A contaminated synthetic heroin batch with MPTP caused irreversible Parkinsonism, modeling Parkinson's pathology. This tragedy proved that external chemicals can induce specific neurodegeneration. Risk rises when genetic susceptibility meets occupational or geographic exposure. Chemicals that protect our food can carry neurological risks. Awareness and protection are essential. Direct physical insults to the brain, traumatic brain injury, can derail movement circuits. Car crashes, falls, or sports injuries can damage wide networks. Post-traumatic tremor, dystonia, or Parkinsonism may appear days to years later. Anoxia from stroke, heart attack, near drowning, or birth complications kills neurons within minutes. These regions are especially vulnerable. Survivors may develop athetosis or myoclonus as lasting sequelae. Stroke is another key cause. Lesions in these areas can directly trigger movement disorders. A subthalamic stroke can cause hemibolismus, violent flinging of one side. Post-stroke tremors and dystonia are common during recovery. Spinal cord injuries interrupt the brain's messages, causing paralysis and abnormal movements. Spasticity, myoclonus, and tremors may arise as reflex circuits fire erratically without full brain modulation. Sometimes treatments themselves cause movement disorders. Tardive syndromes. Tardive dyskinesia can follow long-term use of older antipsychotics. It appears as repetitive movements of the face, lips, and tongue. Drug-induced Parkinsonism is the second most common Parkinsonism after Parkinson's disease. Tremor, stiffness, and slowed movement can be triggered by several medications, including metoclopramide and some blood pressure drugs. Often reversible after stopping the drug, though recovery may take months. Antidepressants, especially SSRIs, can rarely cause akathisia, an intense inner restlessness. Patients pace or rock to relieve the urge to move. In uncommon cases, dystonia or tremors occur. Levodopa, vital for Parkinson's, can itself cause dyskinesia with long-term use. Involuntary writhing may affect limbs, head, or the whole body. Treatment becomes a careful balance to optimize quality of life. Infections can breach defenses and inflame the brain, altering movement. Sydenham's chorea, after strep infections, causes rapid, jerky movements in children. The immune system mistakenly targets basal ganglia. Encephalitis, brain inflammation from viruses like herpes, West Nile, or measles, can cause tremor, myoclonus, ataxia, or Parkinsonism. Outcomes depend on severity and speed of treatment. Pandas proposes sudden tics or chorea-like movements in kids after strep, via autoimmune cross-reaction. Research is ongoing, highlighting the infection-immune brain link. HIV can cause neurocognitive disorder with bradykinesia, clumsiness, and tremor. Opportunistic infections add risk. These infections can damage movement control regions. Early diagnosis and targeted therapy improve outcomes when infection underlies a movement disorder. Internal imbalances can disrupt movement control. Liver or kidney failure allows toxins to accumulate. Hepatic encephalopathy can cause asterixis, a flapping tremor. Electrolyte disturbances alter neuron function, provoking spasms or even seizures. Autoimmunity, as in multiple sclerosis, damages myelin, leading to tremor, spasticity, and ataxia. Lupus can inflame brain regions and cause chorea. Small strokes and poor deep brain blood flow cause vascular Parkinsonism, shuffling gait and imbalance, often without resting tremor. Cumulative white matter damage jams the brain's communication highways. From genes to environment, medicines to infections, causes are many. Knowledge is power. Understanding causes clarifies diagnosis and guides treatment strategies. With the right team and plan, we can restore rhythm to the body's symphony of movement.